Hello. This presentation is going to review directional strategies, a subcomponent of strategic management. And strategic management is an important element in any sort of organizational change or design. It's how an organization successfully pursues change, driven primarily through external market conditions. And this particular presentation focuses on the 30,000 foot strategies, basically that define the organization, what its mission, vision is, goals, and values, and how it gets there. So in other words, strategy formulation, objectives, goals, those sort of things all emanate from the directional strategy process. They all have to be congruent with what the value proposition of the organization is to the market. So let's get started. We'll be using the healthcare sector as an example throughout the series for a couple of reasons. One, I taught a course on it, and two, it's a complex system that both has uniquenesses unlike any other business sector. For example, there's typically one consumer of services, but multiple payers: Medicaid, Medicare, private pay, potentially. That's more of the consumer-driven side, and commercial insurance, AE, employer. And so that's unique among the majority of other industries. It's also 17% of our gross domestic national product, and for having probably the largest GDP in the world, anything that's 17% rising to 20% of it is pretty significant. And the way things are going, it looks to be 40% of GDP by 2030 or 2025. It's not a long ways away. And if that occurs, every financial decision you make, you'll be weighing it against some sort of healthcare decision. Essentially, we'll be paying full value for healthcare services. And right now, if you have a high deductible, you know what that is. So a lot of interesting changes. And how do we handle them? First, we got to define the nature of directional strategies, which include the mission statement. It is a distinctive statement that provides insight into what is unique about a particular organization and what distinguishes it from all other organizations of its type. So that's really what the organization was founded to achieve internally. Vision statements, a statement of hope about the organization will look like if it accomplishes its mission. So it's always out in front of us. The goal is to accomplish it. And in organizations that do accomplish their goal, they set new visions, of course, and keep pursuing them. The visioning process is a really important element, I think, for leadership to drive home in terms of staff, stakeholders, or shareholders, because it's really what we hope the outcome will be it financial or be it social or economic. Values, the guiding principles of the organization on which its business philosophy is based. And we're seeing that with some organizations that might be, like for example, Subaru, and there's a few others that are sort of zero landfill manufacturing. So in other words, they're a big part of how they achieve their mission is through having certain values that are important practices in doing business. That actually may cost more, but provide a social benefit to the community or to the environment. And then strategic goals. And this is where sort of our mission and vision how do you put it? Rubber hits the road. So our statements of outcomes that organizational leadership expect to achieve as it accomplishes its mission while pursuing the vision. So as our strategic planning, and we're setting out what our vision is, from what our mission is, we'll along the way, we need to determine what the market um, wants or demands, because that's where our that's usually why our organization's established. And we need to determine within our market what's hot and what's not, and how do we get there. And we use that to establish goals to create some strategic momentum, which hopefully gets us to our vision. So the mission statement should be a living document rather than simply a public relations statement. Broadly defines the purpose, enduring, underscoring the uniqueness of the organization, and identifies scope of operation. So it's broad, it's enduring, which means it shouldn't be something that would work for the holiday, and after that it's irrelevant. It's much broader than that. It's essentially the soul of your organization. A successful mission statement should include staff's input in order to effectively infuse the culture with a sense of clear purpose. So you'll see that with startups where the staff is usually limited to a handful of people. When you get into the strategic planning phase in a mature organization, the first step is for the board to really visit the directional strategies and determine if they're still relevant. My experience, it's primarily the board who works on both vision and mission, but I absolutely agree we should have staff involved. Absolutely essential need for top leadership to support the mission. And if you don't, you're not supporting the soul of the organization. Elements of a mission statement. Effective mission statements force managers to ask three important questions. Is there anything the organization should be doing that is currently not being done? Is the organization doing something it should stop doing? And is the organization doing something it should be doing in a fundamentally different way? So one really looks at the external environment. Are we missing any opportunities? Is our mission still relevant? So for example, if your mission is to, you're the International Association for the Eradication of Smallpox, and your vision is to eliminate smallpox, and your mission is more along the lines of we're here to find a cure through resources and partnerships to eradicate the smallpox virus. Well, guess what? I think there's only a couple laboratory samples left of it. So that organization is essentially achieved its vision and mission and either dissolves or pursues something else. And so that's sort of one. And then two, is the organization doing something it should stop doing? That's important because there may be some issues. Wells Fargo was recently in the news for over incentivizing their sales team to close more checking accounts, and so there wasn't a lot of ethics or oversight, and it resulted into a lot of fraud. Is their organization doing something it should be doing in a fundamentally different way? And process improvement is something we should always look at, and there's many opportunities to always enhance process. And you may do strategic planning or tactical planning on an annual or every 2-year basis, and many things are status quo. Looking to enhance the way we do things is an important strategy. In other words, it doesn't always have to be this monumental, earth-shattering type of goal. Characters of a mission statement: target customers and market, indicate principal services, specify geography, domain, identify an organizational philosophy, illustrate an organizational desired self-image, and specifically the desired public image. And so here's a tool to actually create a mission statement. So the components: target customers and clients. The individual and group we attempt to serve are do not be limited to only the obvious. So this sort of walks you through the keywords, and that allows you to build your mission statement. Here are some examples. University of Texas MD Anderson Cancer Center. The mission of the University of Texas MD Anderson Cancer Center is to eliminate cancer in Texas, the nation, and the world through understanding integrated programs in patient care, research, education, and prevention. And so it really says it all there. It talks about who they are, who they serve, what they serve in terms of their goal, cancer eradication, it's their total outcome, and how they get there, their philosophy. It's integrated programs. You can take a look at the mission statement of Medtronics. Okay, now we get into vision. Vision are a complex understanding of the history of an organization's, its past accomplishments and failures, perception of the opportunities and threats present in the environment, and assessment of how its strategic capacity or ability to capitalize on the opportunities facing it. In other words, this is our mission. Is it still relevant? In other words, is there a market for it? Okay, there is. What do we have to do to get there? What did we do in the past that worked or that failed? Did we accommodate for that? And what do we need to develop in terms of resources and capacity in order to move forward with pursuing the vision in sort of a new era in time. Leader and vision. The role of the visionary leader as pathfinder is important because as a sage states, a picture of what might be is often more important as what it is. Maybe it's Senge, I'm not sure. It's kind of a cool quote. Leadership is a keeper of the vision if it is to be motivational over time. And that's, I do find very important to make sure that leadership, whether it's a monthly newsletter to all staff and stakeholders that talks about the mission and what we're doing to get there. We get mired in our day-to-day, and sometimes we're focused on just the mission of that day or our department. And we always have to be, or should always be, reminded in a positive way how it comes together in a bigger picture. Effective visions are inspiring, about excellence, make sense, and are flexible. Empower staff first and patients second. Honor the past while looking for the future. And so now we have creating a vision. It's the same thing, a strategic thinking map, put in our keywords, and then helps us pull together a vision statement. So the vision statement for Advanced Optics. Advanced Optics is a leader and trusted partner in helping the world achieve the best possible vision. We are dedicated to delivering innovative technologies and provide eye care professionals and patients with superior technology and the highest quality product and service. We create the future of sight, like their tagline. And then we have HCA Columbia, which was the largest hospital company in the world. Above all else, we are committed to the care and improvement of human life. That kind of says it. Okay, values as guiding principles. Organizations and their members should have some principle of commitment that they stand for and rarely, if ever, compromise. So whether it's environmental, whether it's social justice, anti-corruption, it could be a variety of different things. Family values, so values and beliefs. So core beliefs and values of Genesis Healthcare. Patients and residents are the center of our work. Our employees are the vital link between Genesis Healthcare and the patient and the resident. They are the service we provide, the product we deliver. They are our most valuable resource. Achievement of our mission, of our vision, comes only through the talent and extraordinary dedication employees bring with them every day of the year. And so their core values: care, compassion for every life we touch, respect and appreciation for others, teamwork and enjoyable work environment, and so on and so forth. And working in the healthcare field, particularly long-term care, I think that's an excellent um, core belief and value system. And I haven't had much time to work with Genesis or work for them, but if this is something that leadership really gets down to the line level, I think it's be very powerful. Okay. Strategic goals. So here are the overall goals that we set for the year or for the next 3 years, depending on your objectives. To operationalize the goals of an organization is important to continue the logic and convert the mission, vision, and values into strategic goals. So, for example, service categories are critical success factors. Are those things that healthcare organizations must do well? Okay, pardon me. Are those things that a healthcare organization must do well? These factors are similar to all organizations, in particular strategic groups. So, for example, what we try to do is compare ourselves to our peers. If a customer or patient, in this case, needed a certain type of treatment or rehab or long-term care, we want to make sure that we're providing the most critical success factors against another long-term care facility. In other words, trying to, we're not going to consider an acute care critical success factor, critical success factor for us. It's not relevant entirely. So always look, we put them into strategic groups. This way we know who our benchmark is and what those critical success factors are. So for example, acute care hospital is a reduction in readmission rates. So that's an example of one, just one of many for acute care hospitals. And that's something that you would compare to other hospitals and how well your readmission rate is. Nursing homes, we have what are called the star rating, 5 stars. So a subset of that is strong quality indicators. The number of community facility acquired wounds, for example, are a bad indicator if you have a lot. The percentage of residents who have been vaccinated, pain is another one, and just recently added is actually rate of readmissions back to the hospital. So we still wouldn't compare it to a hospital because a hospital's rate of readmissions is how well they either treated the patient prior to leaving, and more importantly, continued supportive services when they left, vis-a-vis home care or primary care or nursing home care, rehab care. And when their readmission rate is high, they have to really look at what factors are involved there. And under a concept called bundled payment, they can actually see it. And so in many cases, the strategic group a hospital's in is against another hospital, but a strategic group of nursing homes or home care agencies who are influencing the readmission rate back to the hospital requires a hospital-like intervention in terms of picking those providers and creating a subset of strategic groups, which would be called a preferred provider network. So although you might have 7 nursing homes in a market, that would be a sort of a macro strategic group. And then of that, maybe 3 are chosen by the health system because of their outcomes to be in the rehab strategic group. So sort of how it breaks down. Strategic goals. Strategic goals are related to mission, critical activities, and should provide more specific direction than mission and vision. At the same, strategic goals should be broad enough to allow for considerable discretion for managers in formulating their objectives for individual units. Governing board and goals. Healthcare has moved more towards corporate boards rather than philanthropic boards because of the turbulent environment healthcare faces today. The sort of older days, 30 years ago, your board was made up of selected people in the community that had money. Hospitals were largely not for profit due to the Hill-Burton Act, which was federal guaranteed loans to existing hospital entities to rebuild brand new hospitals according to very specific standards. So there'd be some sort of uniformity and control for um, hospital care and delivery under the federal government. And those organizations who decided to become not for profit rather than for profit were forgiven of the Hill-Burton loan. And that's why we ended up with so many not for profit hospitals. Um, it was a pretty significant financial break to make that decision. Um, however, part of funding is providing services and getting reimbursement. Another part as a not for profit is having donors. And so if you put the donors on the board, they feel they have influence. You're in return hoping to get revenue from them. The reality is things have become so turbulent. Considering it's 17% of GDP, everybody wants a piece of healthcare. So the boards now are largely made up of people with business experience, lawyers, other types of professions, and they probably have a board of governance. A board of governors, and it's a larger board that really has no power or influence. It's typically ceremonial, and that's that board that they use now for philanthropic. Okay, governing board is to assure that the directional strategies are carefully established and pursued. That's really their primary oversight. And from that, policies are admitted from the board, and they're usually to reinforce the mission to get to the vision. So when we evaluate directional strategies, we want to manage strategic momentum. Evaluating directional strategies, are we not doing something now that we should be doing, like we talked about? Do our mission and vision allow for innovation? Do our mission and vision allow for expansion? Do our mission and vision and values fit the needs of the stakeholders? Do our fundamental values make sense? And so this checklist is, I always find very helpful to sort of ask these questions of each directional strategy and assure that there's some external business logic to it. Like I said, the difference between what I want to do in terms of a business or a service or a product and what the market is willing to pay for. What I want to do, if the market's not interested, is called a hobby. If it's something the market's really interested in, then it's called a business. So that's a summary of strategic directional strategies. And as I mentioned, they're define the mission, vision, values, and philosophy. And then from there, you would identify the goals going forward. It could be financial. It could be offering a new service line. Maybe it's the migraine center or diabetes management care coordination programs, things like that, that are programmatic strategies to fulfill the mission. Hopefully that was helpful.